My name is Andrea Wahner Hendrickson. I work in the Department of Oncology. Specifically, I'm a medical oncologist with a focus on GYN cancers and phase 1 clinical trials. I decided to get into cancer research early on. Initially, I was really interested in how normal cells become cancer cells and how the immune system can or attempts to fight those cancer cells. But as I got further along in my training and worked with and saw patients with cancer and how our therapies just are not good enough at this point, I really became interested in trying to figure out how to get targeted therapies that look really promising in the lab into the clinic. And so my focus really switched to translational research, where I work with some amazing scientists here at Mayo Clinic and at other institutions across the world to get newer, novel therapies translated into clinical trials as quickly as possible so we can help our patients. So I did recently win an award through the Eagles grant, which I'm very excited about. One of the targets that I'm looking at is a protein called MTH1. There is a group at the Karolinska Institute in Sweden, led by Dr. Thomas Halliday, who a few years ago identified a novel cancer target. So we were able to collaborate with him, and we're trying to move this new agent into clinical trials. And so we anticipate to open a kind of first in human in the United States clinical trial for our ovarian cancer patients, hopefully in 2018. What the Eagles grant is really looking at is, can we better understand how tumor cells become resistant to this new class of drug, or how does this new drug actually work? Because it's newer, there's a lot of question about how it actually works. And so by looking at changes in RNA and DNA in resistant cells, we can work backwards and figure out how those cells become resistant, and that allows us to use this in combination therapy to better enhance the effect of the drug. So ovarian cancer is the deadliest of the gynecologic malignancies. If we look at 5-year overall survival rate, it's only 44%. One of the big problems with ovarian cancer is that we do not have a screening test. And so because we don't have a screening test, a lot of these cancers are detected at stage 3 or 4, meaning that the tumor has already spread throughout the abdomen. And so we are really focusing on how we can improve our treatment strategies, because our current treatment strategies aren't great. I'm very proud to work at the Mayo Clinic. I've had amazing mentors throughout my time here. I did my residency and fellowship training here. I worked very closely with Scott Kaufman and still work very closely with Scott Kaufman in molecular therapeutics, and Lynn Hartman as a clinical mentor. And we have an amazing team, and through the ovarian cancer SPORE, we have a great group that collaborates together to really focus on bringing newer therapies to our women with ovarian cancer.